Probably the best way to look at holistic medicine, or the way I look at holistic medicine, is the right medicine, the right way of looking. Medicine was intended to be looking at the person as a whole unit, not in isolation, not only as a body and soul, but also where does this body live? You know, what the environment is, what kind of family situation, work situation, political situation in society, all these taken together influence the body's response or the patient response to disease processes or whatever is happening to them. So whenever I see a patient, I take all these things into account, and that allows me, I think, to make a better diagnosis and better help for that patient. The first thing I do usually, regardless of what the patient comes to the clinic for, is to try to find out what really is going on with the patient. Because many times that patient that comes with a headache, there are probably many factors contributing to that. It could be just straightforward headache from stress or being in a room full of smoke, but it also could be a sign of too much stress at work, abuse at home, a date rape, any other factor that can make the patient respond that way. And because I work mostly with adolescents or teenagers, almost 9 out of 10 cases, the problem is usually non-organic, something other than straightforward anatomic problem. So by looking at the patient from the entire picture and their life picture as a whole, in most cases we're able to find out what exactly is causing the patient's problem, rather than just, you know, hey, you have a headache, here is some ibuprofen and go, and you'll be fine. Is significant reason for looking at my patients this way. I grew up in Palestine, and I was only 9 years old when the Israelis took over and it was occupied by Israel. And about a year later, my mother developed lymphosarcoma, and at that time there were no treatments available practically, but I had to go through watching her being used as an experimental animal in Israeli hospitals. They used all kinds of unproven or unstudied, at that time no chemotherapeutic agents were studied or radiation therapy. And then when they practically killed all her blood cells and she starts bleeding non-stop, they sent her home. And I have to watch her for 3 days bleeding until she died at home. And you know, even at that age, I looked at things as, this is not a way a physician should be behaving. Even if I fail, and if I were a physician and failed in treating my patient, I would stay with them until the last minute. Not when I fail, I send them home to torture their family, basically. So that was one of the first things that really made me look at life in a little bit different way, to look at medicine as a possibility or a choice that I would go to. And since that time, I always thought, if I do go into medicine, I'll never look at the patient as just a business opportunity. I'll look at the patient as part of me. And if the patient is part of me, I would never do something to the patient that I would not do to myself. And I think that's what led me to the holistic approach in medicine. I do things is by just being myself, and that usually gives the patient the impression and that I do care. And I ask them questions the way that makes them feel comfortable sharing what is on their minds. And usually I go from there. And it's always patient dependent. You cannot have the same approach towards every single patient. Every patient is different. Everyone needs something different. And you have to have that. Always open-minded to anything, any new science, any new knowledge. The difference is I don't take anything for granted. I don't take anybody's word for does this work or not. Whenever something new comes up, the way I approach it is by studying it, looking at it, see if it is scientifically sound. I would never take something just based on emotion or based of I like this physician or I dislike him or I heard a good story. If it's scientifically sound and it sounds promising, if it can be duplicated, then sure I would go to the. I don't at this point. That approach is valid for anything, and there's no need to go really through one or the other. But this is how I look at things.